local, and tribal public health authorities within self-defined service areas to meet partners' unique workforce development needs in the area of public health preparedness and response. Today's webinar, Community Assessment for Public Health Emergency Response, or CASPER, and the development of CollectSmart, survey management and response tools for assessing the health of your community, features Mr. Matthew Smith of the UNC Pearl, Mr. David Zane of the Texas Department of State Health Services, and Mr. Michael Zalek of the Chatham County, North Carolina Public Health Department. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. Please be sure to refrain from placing your line on hold during the webinar. This webinar is being recorded and it will be available on the ASPPH website via a link on the webinar events page soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our speakers today include Matthew Simon, a research associate and GIS analyst in the Research and Evaluation Unit at the North Carolina Institute for Public Health at the University of North Carolina Gilling School of Global Public Health, where he is responsible for providing technical assistance and guidance to state and local public health agencies with data collection and spatial analysis projects related to emergency preparedness and other community-wide or regional public health concerns. David Zane is an epidemiologist at the Texas Department of State Health Services in Austin, where he works with epidemiologists across the state on disaster epidemiology-related issues. And Michael Zalek, a social research associate and public information officer at the Chatham County Public Health Department, where he coordinates the community health assessment process and Chatham Health Alliance, and works closely with the health promotion team on environmental level strategies that impact health. Thank you for being here today, Matt, Dave, and Mike.
Thank you for the invitation, and on behalf of David and Mike, thanks everyone else on the line for joining. Pretty excited to talk to you today about CASPER and CollectSmart. Before I get into that, I just want to mention that we are part of the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. We're in the Institute for Public Health, which is really the service and outreach arm of the school. So our role is really to work as the bridge between academics and practice, with our mission statement there at the bottom. So we do a lot of training, research, and technical assistance to state and local agencies. These learning objectives should look familiar. I'm not going to reread them, but hopefully by the end you'll have a better understanding of what CASPER is, be able to provide some examples of how CASPER has been implemented, and then learn a little bit about the CollectSmart app and project management tool that we've been working on for a couple years now. So this is a long statement of need, and I'm not going to read through it either, but what needs to be said here is that we need good data to make our data-driven decisions, but collecting that data can often be difficult. It's important to have a good baseline of data, especially in health improvement work, but it's not always easy to get it. At the Institute for Public Health here, we routinely receive requests from health departments and other community organizations for technical assistance related to primary data collection. In North Carolina, we have a history of using GIS, or Geographic Information Systems, in sample design and to electronically capture survey responses in handheld GPS units. However, these systems are pretty cumbersome, they're costly, not accessible to everyone, and this is really why we created CollectSmart. So what is CollectSmart? So CollectSmart is a survey management system. It's a suite of software that should help users implement data collection efforts on smartphones or tablets. Essentially, a project manager can use CollectSmart to determine where in their community to sample, and then upload that sample to their mobile devices that's installed with the CollectSmart app. Survey location and progress can be monitored in a web browser, and the data is stored securely on a cloud where it can be analyzed in real time and by the project managers. Before diving too much into the details of CollectSmart, though, I want to talk about a versatile survey method that CollectSmart is particularly suited for and which really served as our foundation for this work, and that's CASPER. So what is CASPER? CASPER is a sampling method that the Centers for Disease Control has created called the Community Assessment for Public Health Emergency Response. Their definition for it is there at the bottom of the screen, and what it really is household surveys with people in disaster-affected areas using a specific sampling method. The method was originally designed in the 1960s to assess immunization coverage, and it's a type of rapid needs assessment. The primary purpose of CASPER is to determine the scope and magnitude of the health needs in a disaster-affected area. It's not designed to deliver aid. It's really a tool to supply decision makers with the information they need to prioritize recovery efforts. Because it's based on that rapid needs assessment framework, it can be completed pretty rapidly in 2 days, possibly with a couple days additional for analysis and report writing to get that information to public health officials as quickly as possible. The sampling method that CASPER uses is something called a two-stage cluster sample. So it's been validated through the years for rapid assessments of an estimation of a variety of population-level public health needs. It gives reasonably accurate results, plus or minus 10%. For the number of surveys you collect, that's pretty good. And it's basically an alternative to a simple random sample or a convenience sample. Simple random sample is hard to get that complete sampling frame of every single person in your area. It does require fewer surveys to do a simple random sample, but it's not as easy to implement. Convenient sampling takes a lot more surveys, and just because you have more doesn't necessarily mean that it's better. The key advantage to clustering is that it's just that right number of surveys, right in between the two, and it reduces the travel time and costs by focusing your efforts on neighborhoods within the sampling frame. Another important aspect of CASPER is that it is conducted door-to-door. And as some of you may be aware, if you've done this type of work before, door-to-door data collection is difficult and can be exhausting. So why are we advocating for this method over others? Namely, we think in the end you get more representative data that can be generalizable to your entire sampling frame. The main reason being is that it's accessible to everyone. Not everyone has internet access, not everyone has telephone, and so in that sense, the door-to-door is really the way to reach the most people. Another big advantage is the data quality. So we think that you're getting more complete data when you're going face-to-face with somebody. You have the opportunity to provide clarification on certain questions. You can make sure that every question is answered. And we get higher response rates. You usually get 60 to 80% response, which means we have a lower chance that bias is in our sample. The final reason is visibility, and this is one that's not as easy to put a number on and measure, but getting out there in the community puts a face to your organization and can help with recognition. It's really boots on the ground public health work. So now that we've talked just a little bit about what CASPER is, I want to mention some of the most common applications. As I said earlier, it is very valuable in assessing the health status and basic needs following a disaster. But it can also be used ahead of time, so in community preparedness work, to determine what the level of preparedness of your community is. So that could be figuring out access to emergency supply kits, whether or not people would evacuate if they were asked to do so, a number of things. But a real strength of CASPER, I think, is that it's fairly versatile. So it really can apply to any routine data collection activity. In North Carolina, community health needs assessments are required for local health department accreditation every 3 to 4 years. And with the Affordable Care Act, hospitals are also required to perform a CHNA. every 3 years. So this is our main application of CASPER in North Carolina, and it's very valuable for that. It can also be used for any type of opinion that you're trying to gauge from your community. We did a survey around a nuclear power plant here to determine how many people actually have potassium iodide present in the chance of a nuclear or disaster at the power plant. Potassium iodide could act as it protects the thyroid from radioactive iodine uptake. So we did a survey and determined that not many people had it and that we needed to up our public health messaging and figure out maybe a different way to distribute it. We've also used it for things like assessing the community's beliefs on teen pregnancy prevention campaigns and what the best approach to that would be. So it's fairly versatile. Again, it's the community assessment for public health emergency response. So that, in the end, remains the primary purpose of it. And this is what the CDC primarily uses CASPER for. And they've used it all over the world. Again, the value being that you can quickly determine the number of people that are affected. You have people on the ground assessing physical damage to homes. And then you're assessing those basic public health needs: electricity, clean water, food, communication, access to health services. So as a way to kind of give a little more background on this, I'm going to turn it over to my colleague Dave, who's on the phone, who works in Texas, and he's going to talk about an application in 2011 that his team responded to following a wildfire. Dave?
Great, thank you, Matt. In 2011, Texas was in the midst of an extreme drought, the worst on record. One weekend in early September, 57 wildfires were ignited across the state, including one that started by high winds that knocked trees into a power line in Bastrop County, which is approximately 30 miles east of Austin, which is in central Texas. This wildfire ultimately destroyed over 1,600 homes and sadly caused 2 deaths. It was declared a federal disaster. In response to this terrible tragedy, our health service region in that area, Health Service Region 7, used CASPER to assess the needs of Bastrop County residents who had been affected by the wildfire. Our colleagues in this regional office are CASPER trained and are very, very experienced in CASPER methods. Working with local officials, they developed a 2-page, 34-question paper survey. The questionnaire addressed a variety of topics, including the level of structural damage to the homes, availability of basic utilities, injuries, mental health status, access to medical care, evacuation behaviors, as well as messaging. After the interviews were completed and the data were analyzed, these public health officials wrote a report that was shared with local county officials. Data was used in grant applications for long-term recovery activities. For instance, approximately $500,000 was awarded to aid in mental health recovery. Another $4.5 million was received to assist in building roads, to assist in future evacuations. And finally, one recommendation from the CASPER survey was to continue to work with homeowners associations to disseminate accurate information on evacuation, cleanup, and preparedness for wildfires.
Great. Thanks, Dave. So another common example, as I mentioned earlier, are the community health needs assessments. So CASPER's value in these routine data collection efforts are that it can be used to help determine the community health priorities. So asking directly to the community members, what are your concerns? What are the priorities that you'd like to see the health department or the hospital address community-wide? It can be used to estimate population health status, access to care, so you can figure out roughly, are there service gaps? Are there areas where people are not getting the care that they need. I mentioned community preparedness already, and finally, another common thing we assess when we're using CASPERs for these CHAs are those services that need improvement. So do we need more parks? Do we need more trails? You know, what's a number for that? How many people agree with that statement? So to kind of highlight this application, I'm going to turn it over to Mike in Chatham County, who we assisted just last year with their CASPER.
Yeah, thanks, Matt. So as Matt said, I'm Mike. I'm in Chatham County, North Carolina, and last year we went through the community health assessment process, the public health department in collaboration with Chatham Hospital. So one of our goals of the assessment process was to gather a representative sample of data from households, and to do that we utilized the CASPER method and CollectSmart in collaboration with the Institute for Public Health. So we really benefited from the training we received from them. They walked us through the process and helped us to understand just the process of going through this data collection, and B, how to use the tools that they developed. So over the course of about 6 days, we fielded in total 25 teams or so and collected 190 surveys across the county. And again, this was a representative sample from all over the county. And being a rural county, this was very beneficial because, as you can imagine, houses are pretty spaced out. So instead of doing a simple random sample, the CASPER method allowed us to randomly select certain census blocks and visit those. So there are a number of advantages of using this that we wouldn't have had if we chose some other route. First of all, we assembled a team of volunteers from the health department, from nearby UNC Chapel Hill, volunteers from our steering committee, and we were able to quickly train them on the methods and on the tools that we were using. And considering how complex these things can sometimes be, it was really easy to get them ready to go out in the field and maximize the time they were able to collect data. The tools collected households randomly. This is it can be a tricky thing to figure out exactly how you're going to pick which households to go to, and we want to make sure that that's statistically valid. So the tool enabled us to do so. And then when we were actually going out to the field, to point the teams in the right direction, and they could look at these maps to go to the right house. When you're dealing with that many teams and volunteers, people you don't necessarily know that well, it's really important to be able to coordinate. And with these tools, we knew exactly where the teams were, what census blocks, areas of the county they were in, and that was both good for safety concerns and also ensuring that we didn't duplicate efforts. And then if any homes were missing in the census block and we had to go back, we were able to easily look those up. As you all likely know, to do surveys electronically is much better than to have to type them in later if you've done them on paper. So this method, pop it up on the tablet and just go through it right there, and then later in the day upload them, and everything goes right into the database, which made analyzing the data and generating results very easy for us. So it was a really useful tool that we had access to, and we were appreciative to the Institute for their support in this process and allowing us to collect a really good representative sample of data.
Great, thanks, Mike. So we've heard about 2 applications of CASPER, and using the tablets, using GIS to implement CASPER, there are several barriers, and actually just without the electronics involved, there's barriers such as having that sampling expertise, the statistical mapping software, and the data collection software and hardware. And this is what we really targeted CollectSmart at, was to kind of address some of these barriers. The sampling, as Mike mentioned, there's automated cluster sampling that you can perform online. The CDC has EpiInfo, which is their desktop version statistical package, which allows you to create forms very easily, digital forms, that you can then upload to CollectSmart. The dashboard has mapping features so you can monitor teams while they're out there. And as Mike said, collecting that information digitally on tablets and smartphones really speeds up the analysis process. And moving to tablets and smartphones is also much cheaper and more and easier to train people on than the GPS units that we used to use. So we came up with this concept about 2 years ago now, summer of 2013. Began piloting it right away that summer, and in about the last couple of years we've done 9 surveys using the software, collected about 1,700 interviews, and it's been an iterative process. So we would put out a version, test it out, get feedback from users, make changes based on their recommendations, and then test another version. So we're really, what we have completed now is what we're calling the 3rd phase. So we got a lot of feedback from users, but we realized we needed feedback from project managers too. So I approached Dave in Texas, and I flew up there to give him a demonstration of the tools, and Dave's going to talk a little bit about how that went.
Yeah, thanks, Matt. So over the last decade, our state health department has been building CASPER capacity across Texas. We collaborate with our local and regional health departments. We have sponsored CASPER trainings, developed a pocket field guide and WAFER resource card, and we've developed a CASPER website. So today in Texas, there's been at least 17 CASPERs that have been conducted by local or regional health departments in post-disaster settings or to identify routine public health issues. So Matt came down several months ago and met with us at the regional and state health department, as well as some EPI students at Texas A&M University, and we had an opportunity to pilot test Collect Smart. The pilot test included taking a sample of census blocks, navigating to 3 different random points, and then conducting practice interviews. We were really impressed with it. For instance, we really liked the speed of the sampling function. To test it out, it took less than 1 minute to pull a 30 cluster sample from Harris County. Harris County represents the city of Houston, and that county has about 1.6 million housing units. So we were very impressed with the speed. We made several suggestions to Matt that we thought might be useful.
Thanks, Dave. So we took some of the project management feedback and incorporated that into this release that we have now. And we also developed some training materials to go along with it. We have a user manual that will walk a project manager through every step of implementing a CASPER using Collect Smart. We have some online self-guided training modules, and we're still developing other materials. We're still trying to figure out the best way to deliver the training materials for this project. So back to what exactly Collect Smart is. Essentially, it's a website and a mobile app. The website has a set of project management tools that allow you to do sampling in your area, to monitor your teams while they're out there, and it serves as a data repository and allows you to do some real-time analysis. The mobile app gives users the ability to navigate within their clusters and then, of course, digitally record the survey responses. The mobile app is built on top of the Android version of EpiInfo Mobile. So this is something the CDC has developed. EpiInfo, as I mentioned earlier, they have a mobile version that's been released on both the Play Store and the Apple Store. And what we did is essentially tack on some mapping capabilities to that. So, EpiInfo already has the ability for you to create questionnaires and analyze results on your desktop. So we didn't think reinventing the wheel made any sense there. We were looking for something that was free, open source, that as many people could access as possible. This current version of the mobile app is only compatible with Android tablets and phones. We're exploring the possibility of iOS development. As I mentioned, it allows you to navigate to these pre-selected sites. So on the screen you see some addresses and some points that are X'd out when they're complete and green when they still need to be conducted. And one of the important things that came out of all of our pilots, as Mike mentioned, Chatham County is rural. We have a lot of rural counties in North Carolina, and cell coverage is not always good. So the app depends on a data connection, but we have developed an offline mode where it will function without the app, in the absence of cell coverage. So that's the app side. The other important side is are the project management tools. So again, it's web-based. There's no software that you have to install. You just set up a user account and log in. There's GIS-enabled site selection. We're using the most current census data. It does allow some frequency and analysis of results. Very basic. You can pick a question and look at the answers as they're coming in. You can see the counts and percentages. And of course, it's taking advantage of the internal GPS in the tablets and the phones to do some real-time mapping. It will show where the surveyors are, and it will show where they completed the interview. And that's both a safety feature and a method to enforce the sampling method to stay within the cluster. Cloud-based database for survey responses and also added security. So everything is stored, password protected and encrypted. So when you go to the site, one of your first options is to create a new project. And the big advantage to this system is that it does automate the cluster sampling for you, and that is currently available nationwide using 2013 block groups. But you don't have to use CollectSmart to perform a cluster sample for a CASPER. You could upload your own spatial files, so we have that option as well. So if you have a simple random sample with points already picked out, you can upload those. Or if you like to do the cluster sampling on your own in your own mapping system, that's a possibility as well. The site selection tool, if you do decide to use it, is pretty straightforward. In this example, it shows you select a state, a county or multiple counties. A summary will be given of the population and housing units within that area. You can designate the number of clusters or neighborhoods that you'd like to sample in. By default, in cluster sampling, we usually do 30 by 7. And there's also the option to set a threshold. So if you don't want to, if you want to make sure that you have clusters that have enough people in them, you can check the box there to require a minimum of 7 housing units per cluster. And then the final option there is that you can, by default, it will use blocks, but you can also have it choose to use block groups. So one of the more exciting things about the tool, again, is this project dashboard. And so this is your kind of your command center on how you run the survey. So in the upper left-hand side here, I think you can see my mouse, there's a drop-down menu there where you can pick the point or the surveyor, and it will highlight them on the screen and bring you right to them. So you can access or find where people are pretty quickly. Below that is a response tool. So this tool will summarize the responses for each one of the questions in your questionnaire. And then on the opposite side of that is our progress tool. So this keeps track of the number of surveys completed within each cluster so that you can have a running total and figure out, if you need to make adjustments, send teams to the areas for help. That's a nice feature as well. And then on the screen you have your points, which again, green indicates that they still need to be collected, and then when they're completed, they are X'd out on the screen. So that's the meat of the tool, is what we're calling the dashboard. Now I want to emphasize that even though CASPER was the inspiration for these tools and it's based on this sampling method, it's not limited to just CASPER. Any data collection opportunity that you might have, whether it be convenience sampling or some other simple random sample, or a function that you need to perform at the health department, such as a well inspection or animal service complaint. If you need to collect data on your community, there's a good chance CollectSmart could work for you. So our current release is still beta. We have a lot of things that we'd like to do, next steps that we'd like to add, such as turn-by-turn navigation from point to point or cluster to cluster. Some of this feedback actually came from the Texas pilot with the project managers. One of their ideas was, let's eliminate the need for a GIS and let's just make our field maps from this. So going back to the dashboard, having the ability to export from this screen to make field maps, I think would make it very valuable. Right now you can just take a screenshot if you need it, but making that a little more user-friendly, I think, would be a logical next step. The tool does select clusters, but it does not select the households yet. And that's another thing that we could explore adding on. The main reason it does not select households is that the national address databases are not very reliable and costly. Block sampling also is only available currently in North Carolina and Texas. And so that's a feature we would definitely want to explore, is offering that nationwide. Block group sampling is available nationwide. We've thought about some more analysis reporting and summaries. So, we're collecting in all the survey responses, and it'd be easy enough to kind of push out a report summarizing the findings. And then this came up in a survey we did just recently, just a couple weeks ago, and that was, it'd be nice to be able to push notifications to the teams for safety warnings, so thunderstorm coming or something like that. And I mentioned already cross-platform compatibility. iOS, I think, is probably a pretty big need, and a large group of people would find it useful to use on their iPad as well. So we are currently so we've been working on this for a couple years, and we are at the point where we would like to get more feedback from other people who might want to use the tools. You all are the first group that we're kind of rolling this out to, and so if you have an interest, if you have a project in mind, or if you just have questions, there's a link on the screen, the tiny URL, Collect Smart Info. It's a form that is asking for your name, your contact information, and a description of the project that you have in mind that you might want to use Collect Smart for. What we'll end up doing is, we don't really know what kind of response we'll get, if we'll have 10 people who are interested or hundreds of people, because we are promoting this throughout North Carolina to other groups, and in Texas to groups as well. So we might have to prioritize, who we can provide technical assistance to. So if you are interested, please visit that link and let us know, or feel free to email me directly. My contact information is at the end of the presentation. What you'd actually need to use the tools, EpiInfo Desktop, which is free, you can use to design the form. And as I said, it's very easy. It's drag and drop. What used to take me a week to do, I can do in EpiInfo in just a matter of hours. So you need EpiInfo, you need the Collect Smart app, and then a user account on the Collect Smart website. If you want to learn more about CASPER, the CDC has created a CASPER toolkit, and it's a document that walks you through all the steps. They also have sample forms and a questionnaire bank. And if you want to learn a little bit more about Collect Smart, you can visit our website as well, and there's some information there, and the link to the form, I think, is also there. So that's all we have. Again, I want to thank everyone for tuning in, and we wanted to leave plenty of room for questions, and I think we have. So at this point, I think I will turn it back over to our hosts, or open it up for questions.
Great. Thank you, Matt, Dave, and Mike. We will now take this time to address questions, so please feel free to type your questions into the question box. Great. Well, we'll start with our first question. The first question is, when can I start using Collect Smart?
That's a good question. So as early as next month. that's our goal, is to get it out there probably the middle of August. We have a couple loose ends to tie up. We want to finalize the user manual so that if somebody wants to go through it self-guided, they could. So really we're looking at probably the middle of August.
Great, thank you. The next question is, how many people does it take to do a survey?
Right, so that's a good question as well. So what we usually do is schedule a Thursday to Saturday, full days, 10 a.m. to 6 p.m. We send out 10 teams of 2, so that's 20 people a day. And it's a pretty big ask, and that's probably the biggest challenge in doing this work, is getting together these staff to go door to door. But reaching out to your community partners is the best way to to recruit volunteers. Working with United Way, they also have to conduct community health assessments. As I mentioned, health departments and hospitals have to do these assessments. And if you're not doing a health assessment, if it's just some other survey, we're reaching out to anyone who's interested in possibly applying the data.
Great, thank you. Can you talk about a cost associated with either the SMART app or any of the other devices that you need to use CollectSmart?
Sure. So the cost is free. The CollectSmart is free, and so is AppInfo. What you need is a piece of hardware to install the app on. We have, in some of our surveys, installed it on health department staff's smartphones, and it's worked great. The key limitation being that it has to be an Android phone or tablet.
Terrific, thank you. Another question asks, how can we train volunteers to collect data and use CollectSmart?
We have some training materials developed that we are definitely willing to share. We usually do a 3-hour just-in-time training, either the morning of the survey or the day before, and that should cover why you're there, interview techniques, strategies to increase the response rate. Safety should be a #1 priority. And then it covers the sampling method itself. Spend plenty of time going over the questionnaire. And definitely, if you're using the technology, you need to give people plenty of time to practice with it.
Terrific. And we had one participant ask if you could actually review the sampling again that is used in CollectSmart.
Sure. The cluster sampling is a public health strategy, and it basically divides your sampling frame into neighborhoods. We typically use census blocks or block groups because they cover the entire area and it has good population information. In the first stage of the 2-stage cluster sample, you randomly select clusters with a probability proportionate to size. So the ones that are larger have more people in them, have a higher chance of being selected, but it's still random. So you have to account for that when you do the analysis and weight your results. The second stage can be done a number of different ways, but the idea is that you randomly select 5 to 7 interviews within the cluster or interview locations to collect an interview. And that can be done either you can train your volunteers to go to every 7th house, or you can give them a random starting point, or you can determine those starting locations ahead of time.
Terrific, thank you. We had one participant write in saying that she's looking at a project that may need a bit of time to develop it with her partners. So how much time do they have to submit a request for technical assistance via the link you posted on the webinar?
It'll be open for a while. If you have an idea, it doesn't hurt to go ahead and put that information in now, and then I'll have your contact information. I can get back in touch with you if I need, and you can think you'll probably be able to go back and update it if something changes. But really, yeah, anytime is fine.
Great, thank you. Another question asks, will the user manual be made available even if there is no project in mind at that time?
Yeah, it'll be on the website, and we'll publish that URL, like I said, in a couple weeks when we go live. And on the website, they'll have links to some training materials associated with CASPER and associated with CollectSmart, as well as that user manual. So yes, that will be available.
Great. And can you just talk a little bit more about what resources exist to learn more about CASPER?
Sure. Let me actually go back in the slides maybe. So the CDC has a website that I encourage you to check out. They have a CASPER group, and on that website, if you just Google CDC CASPER, you'll come up with it. They have links to short articles of how they've implemented CASPER. They have their toolkit, which is a long document which describes preparation, implementation, analysis, and reporting, every stage of CASPER, as well as some sample forms and a question bank. At the North Carolina Institute for Public Health's training website, we also have a couple online modules. You can search by keyword. You search CASPER or Rapid Needs Assessment, they'll come up. One is an intro to CASPER that we just completed recently, and that will give you a good sense, a little bit more detail about what CASPER is. And then there's some other trainings on the training website as well.
Thank you. Another question asks, what is your view regarding generalizability of the tool across different continents like Asia?
Right, so it definitely is not functional outside of the U.S. for sampling purposes currently, but I don't see any reason why it couldn't be implemented, why other parts of the tool couldn't be used outside of the U.S. So if you wanted to digitally collect a survey, then you could certainly use that function of the tool. If you wanted to track where the surveyors are, that's going to function too, because it's tracking the GPS satellites, which are worldwide. The sampling is the limitation there, in that we don't have we're not familiar with other countries' census methods necessarily. The U.S. has very readily accessible data, but CASPER can be implemented without any technology at all. You can select your neighborhoods by hand. You can collect your surveys on paper. It's a valuable and versatile method in that sense. We use the technology to make it easier and faster, but it was designed in areas without a lot of resources in mind. So it'll work wherever you want to do it, but it's slightly more challenging.
Great, thank you. And we'll wrap it up with one final question. Can you talk about where you can locate questions to use for a CASPER survey?
Sure, I might defer to Dave on that one. We use a lot of community health assessments are mostly how we implement CASPERs, and the North Carolina Division of Public Health has a template, and a lot of counties use similar questions. BRFSS, the Behavioral Risk Surveillance Survey from the CDC, has good source of questions. The key is really not testing out new questions when you're at somebody's doorstep, but using existing validated questions. Dave might have some other suggestions as far as questionnaires specifically for disaster response.
Right, yeah, Matt. Matt had mentioned about the CDC CASPER toolkit. At the back of that CDC CASPER toolkit, they do have a questionnaire bank where they provide information on the types of questions that have been used before, and that might be a good starting point to as you look at designing the survey. Our recommendation is, as you look at doing a CASPER, to make sure you have clear objectives that are locally based and can provide good information for local and county officials. Because part of the hardest thing about doing a CASPER is designing the survey. Because you, as Matt mentioned, you want to have good, validated questions. So that's another resource, is the CDC CASPER Toolkit.
Great. Well, thank you all for joining us today, and thank you again to our speakers, Matt Smith, Dave Zane, and Mike Select. As a reminder, this webinar has been recorded and will be available along with the slides on the ASPPH webinar event page soon. You can see the URL there. Also, please be sure to contact us with any additional questions, and check the ASPPH events page to register for the next webinar in the ASPPH Presents series, using exercises to measure preparedness, featuring Dr. Paul Bittinger and Dr. Elena Savoya of the Harvard T.H. School of Public Health, Pearl, presented in collaboration with the CDC Office of Public Health Preparedness and Response, which will take place on Thursday, August 6th at 11 a.m. Eastern Time. Thank you all again.